Have you ever picked up your prescription from the pharmacy and noticed that your medication looks a little different this time, even though it is supposed to be the same generic drug? The simple answer is that it is completely normal and expected for generic epilepsy medications to vary in appearance from one manufacturer to another. These differences in shape, size, color, and markings do not affect the drug's effectiveness or safety. This variation happens because, while the active ingredient must be precisely the same as the brand name version, pharmaceutical companies have flexibility with the inactive ingredients. These inactive components, known as excipients, are things like binders, fillers, colorings, and coatings. They help from the pill and can make it easier to swallow or aid in its absorption, but they do not contribute to the medication's therapeutic effect. Different manufacturers use different excipients and unique manufacturing processes, leading to the visual distinctions you might notice. Furthermore, regulatory bodies like the Food and Drug Administration, or FDA, requiring that generic medications are bioequivalent to their brand name counterparts. This means they must deliver the same amount of active ingredient into the bloodstream over the same period. Companies also use distinct shapes and markings for their products to prevent confusion and protect their intellectual property, which is another reason for the visual differences. If you notice a change in your medication's appearance, the most important step is to always double-check the label to ensure it matches your prescription. If you are still concerned or have any questions, please do not hesitate to speak with your pharmacist or doctor. They can confirm that you have received the correct medication and reassure you about its equivalence. Never stop taking your medication without consulting a healthcare professional. Understanding that these visual differences are normal can bring a lot of peace of mind. Generic medications offer a safe and effective way to manage epilepsy, providing the same critical active ingredient as their brand name versions. The key is consistent use of your prescribed medication, regardless of its appearance, to ensure your epilepsy is well controlled.